We are now going to move on to Gill and her extensive clinical experience in general practice has been recommending BioMin since 2016. So Gill, you speak about the science of BioMin being so compelling. How do you convey this to your patients?
Hi, good evening to everybody, and thank you for this, and thank you to TRICARE and Richard Watley for asking me to convey some of my experience. Yeah, I mean, with regard to the science of everything, there's been so many other products out there, and discovering BioMin by chance in 2016, the evidence has been quite compelling and supporting. It's been one of the best discoveries. Who kind of knew that a bone substitute within bioglass could be optimized within toothpaste, and dissolving quite quickly in order to sort of increase the pH of the mouth, which is then kind of helping against the hypersensitivity, occluding the dentinal tubules and providing some relief for patients with hypersensitivity. Protecting for anything up to 12 hours against this acid attack and helping encourage remineralization. There's a lot of science to talk about this, and it's kind of not, you know, I understand a lot of the science, but sciencey. No, my patients don't understand too much science. So when I'm actually conveying this to them, I generally talk about it as a smart glass and a smart toothpaste, and it's very specific, very special in a dental practice. It's not readily available within supermarkets, and I think that, you know, that supports our profession and our professionalism. And I explained to them, you know, once we've optimized and once we've actually worked out what the causes of the hypersensitivity are, we can then suggest the toothpaste going forward. So, you know, we talk about sort of acid attacks and diet and so many other different things that both Donna has been talking about and David was saying about patient individuality, which I'm passionate about. You have to treat everybody as an individual, and you have to assess everybody as an individual. So that's how I convey everything in my very Yorkshire way. So
thank you. And yeah, everybody is so individual, aren't they?
Yeah.
And can I ask you now, Gill, what attracted you to introduce BioMin into your practice for your patients?
Oh, well, you see, for 20 odd years, I've been treating this lovely lady called Denise and her family. Denise actually works for TRICARE in the admin department, I think. And she came along with this tube of toothpaste that had been sent by a lovely rep called Claire Nichols, who works for TRICARE, and said, try this. And I thought, something else to try. But my mother is rather wonderful that she's got smoking-related periodontitis with extensive toothbrush abrasion, because as we all know, our family members don't listen to us. And she's got extensive recession and extensive sensitivity, and they don't listen. I said, yeah, well, try this. So she's not having any of that. So she goes away, and then the next thing is, it's not bad, that toothpaste, is it? And so I kind of think, oh, well, wow, we're staggered. She's a very forthright Yorkshire woman, and we kind of decided that I'd look into the science of it, which was quite compelling and wonderful. You know, and our patients, as you know, they are much more focused now. So moving on from my mum, we decided to start looking into it for our patients. And you know, patients are much more health focused. They're much more into diet, and smoothies are taking over the world and causing extensive hypersensitivity. Processed foods, we've got sugar in processed foods, altering the pH of the mouth. And the demographics of some of my patients obviously come from lower socioeconomic groups and not necessarily have the right education or not necessarily have the right access to adequate care. And so, you know, to recommend a product that's going to actually work really well and cover every more angles than possible, you know, I mean, it's great. It's been a great thing.
Yeah. Well, no, thank you for sharing that. So since you've been recommending BioMin for so long, can you please now explain how some of your patients have really benefited? And can you share some examples, apart from your mum?
I'm very similar to Donna, actually. You know, the examples that, you know, without sort of repeating what Donna said, my experience is extremely similar to Donna. And you look at, you know, sort of patients that have this generally non-carious sort of tooth surface loss. You're looking at erosion, attrition, abrasion, bruxism, many of these things together, you know, and, you know, separately we could talk about individual remedies. We look at altering the diet, we look at sort of identifying what's actually causing these problems. But with the BioMin F, it's kind of covering all bases. Before, we used to have to work out what the problem was with erosion, with abrasion. We alter the toothbrushing, you know, we alter sort of the diet. And I find certainly with a lot of the diet stuff that I'm talking about, you know, the dietitians are telling them to eat five pieces of fruit and veg a day and to graze. So when does the mouth get to neutralize? And so we do need a product that's going to support that. And I kind of believe that this does. You know, once we've identified what the problem is with these patients, you know, certainly with erosion seems to be on the increase. The younger people are probably having a lot more fruit ciders. Some of us of a certain age are having more prosecco. And in my opinion, it's been revolutionary in trying to sort of help these patients by introducing the BioMin, and we've seen some really good results. It's all anecdotal, obviously, because it comes down to experience, and I'm sure Donna and Gita and everybody else say the same thing. It's you know, a long time of experience. The same for yourself. Perio is the bulk of what we do. So in my practice, so we've seen increasing recession, increasing TB abrasion. And before, we used to say that teeth were poor and hopeless, and we kind of give them more of a guarded prognosis. So these teeth are lasting a lot longer, and therefore we're seeing an increase in hypersensitivity, and BioMin's just been fantastic to support that. So moving forward, you know, I don't know about everybody else as clinicians, but xerostomia seems to be quite much more prevalent, and we're seeing many more patients with multi-medication, I would say. And just sort of as an adjunct, I'm seeing a lot more patients on antidepressants. And as we know that SSRIs will cause a serious amount of xerostomia, not huge, but a little bit. And so we need some sort of buffering action that BioMin F is going to give us, changing and helping support, increasing the pH, giving a more longitudinal support with the pH. I mean, just giving you some stats, there's about 7.3 million people currently on SSRIs. That's 17% of the population with a possible xerostomia and possible hypersensitivity. You know, you could go on. We're all clinicians on this webinar tonight, and we've all had lots of experience with what's happening. And it's you know, it's looking at oncology. We're actually treating more oncology patients actually in general practice with the effects of the chemotherapy and the radiotherapy. And BioMin is supporting that, and it's something that really I would encourage clinicians to actually stock in their practice, because it's not on the prescribers list. So I think, you know, giving patients access to it is phenomenal, really. I could go on.
I couldn't agree more. No, I know, it's so interesting as well, hearing everybody's input and experience on that. And everybody's different in the way that they communicate things. How do you communicate and identify dentine hypersensitivity with your patients?
Well, I have a friend of mine, and I have a lovely question that we kind of pose when they first come in, and we generally say, how are you managing to keep your your mouth healthy, or your health mouthy even? And so they will either say what they say, or their eyes will go up and left and the rest of it. And then say, well, are you having any bleeding? are you suffering from any sensitivity, any pain, any discomfort? And at that point, it's our job to try and identify where the potential hypersensitivity problems are coming from. So, you know, I mean, traditionally, you know, traditionally we were limited. We had to try and establish what the cause was, and then try and fit a product to go with that cause. So, you know, there's Novamin that David was talking about, which was in a certain product that was targeted for erosion, and then you're looking at high caries rates. So we were then using a different product, and you know, this BioMin F, which is fantastic, covers all those bases, does it not? I think it does. And so, you know, the evidence base is there. We're fulfilling and fitting all demographics across the board. This product will do that. You know, and so professionally, the way that I feel about it is that we've got a product here that we can stock, support as a professional product. We use it topically for our patients who are whitening their teeth. We use it topically after we've removed any protein layer. So yeah, it's great.